So who's excited to learn about Obamacare?
Yeah.
Woo!
Yeah. We go to the dentist.
Rather get your tooth pulled, yes, understand. Does anybody know anything about it? Have any questions from the start?
It's going to cost us all.
It's going to cost you all. Okay, may not. May not.
I have a question. Maybe you'll explain this throughout your presentation, but the people that are getting dropped by other insurance companies like Blue Cross Blue Shield, are you going to go into that at all about why that's happening?
We'll do that in Q&A. Actually, I'll tell you actually from the start why that's happening. Because of the laws, certain plans aren't going to be offered, and certain carriers don't want to offer those plans because they're going to have to offer them to everybody. Like for myself, I'm a type 2 diabetic. Blue Cross has never wanted to insure me. So they're going to be dropping you left and right. And what they're doing here, like I'll give an example. Your United Healthcare is going to something called the Navigate network. So all your carriers are going to have very, very slim networks in the Obamacare network if you go through the exchange. The only way you're not going to get that slim network is buying privately. So don't worry about losing your plans. The plans you're probably losing are worth losing. You're going to see the plans are actually a lot better,
Well, we're in
surprisingly.
a policy, but I have friends that I know have already put on Facebook that they've been dropped. And I wondered if they were being dropped or if they're just being told that they have to pick another plan.
If they're being dropped and it's happening right now before December they're being dropped, then likelihood is that they don't have essential health benefits. Actually, we're going to probably push through this and you're going to see that. Now, essential health benefits and also, you know those high deductible plans that we've had of $5,000 and then people have their 80/20s? We love that, 80/20 coinsurance. But the whole thing that people fail to realize is what is our max out of pocket? A lot of those plans have $15,000, $20,000, $25,000 max out of pockets, and that's why they're being dropped. So Obamacare and small business. Hopefully I do this. I'm going to use this one. All right. We're going to go over the agenda. Individual and self-employed. That's typically the same thing in the eyes of the law for Obamacare. Individual plans and self-employed, you're going to be in the same market. So the definition of being self-employed, if you have employees but they're 1099, not W-2'd, you're still self-employed. Small group is your less than 50. Large group, of course, is over 50. We're going to talk about the law and the penalty, how we can avoid it. Current coverage versus Obamacare. Your options you have and how you can obtain coverage. The first thing is, we're talking about the law and the penalty. What is Obamacare? What law and penalty? Well, we can't really say penalty anymore. It's actually a tax. So the correct word is tax. So we're going to show you how to avoid our tax. Healthcare reform, which nobody knows what it is or the definition of it. What is it? The Patient Protection and the Affordable Care Act. So I'm glad this summed it up for you. The Patient Protection and Affordable Care Act will ensure that all Americans have access to quality, affordable health care and will create the transformation within the health care system necessary to contain cost. The Congressional Budget Office, CBO, has determined that the Patient Protection and Affordable Care Act is fully paid for. Will provide coverage to more than 94% of Americans while staying under the $900 billion limit that President Obama established, bending the healthcare cost curve and reducing the deficit over the next 10 years. Whether you believe this or not, or understand it, we're going to fully understand it with the next few slides here. This is a table chart here showing you about where you stand, the mandate and the 2014 tax penalty, the 2015. As you can see on the far left, it says individual and self-employed, the mandate, you must have a qualified health plan. So some of us are losing coverage, some of us don't have qualified health plans, some of us are quote-unquote grandfathered, and we'll talk about that as well. 2014, if you do not have a qualified health plan, you're going to be penalized 1% of your yearly household income, or $95 per person of adults, and then $47.50 per child. You're capped actually on that on the bottom one of $285. So if you have 6 kids, we're not going to charge you past $285, but 1% of your income. So what this goes to say is that if you make $60,000 a year and you're being charged 1%, out of your tax return, $600 is going to come out. Okay. 2015, it's going to go to 2%. 2% of your yearly household income. The penalty is going to go to $325 per person. As you can see, each year they're going to start pricing it higher and higher. If we went to 2016, it's going to go to 3% or 2.5%, so on and so forth. So eventually they're going to price you into having health care. Small groups, there's a lot of questions out there about small group. You are not required. You could receive a tax credit, and that's what they're trying to push. So by receiving your tax credit, basically they're going to give you 50% of what the employers pay year 1. Year 2, they're going to pay 35% back as a credit. Year 3, you're going to lose it. So it's kind of like a bait and switch. They're trying to get small businesses to, offer the group health care, but a lot of times it's not feasible to do so.
Now, if you work for an employer, say a small group or a large group, and you're forced to get your individual first, and then they offer it, are you then required to convert over to what they have offered, or can you?
You have to convert.
Keep what you have?
Well, you can keep what you have only if you're not getting government subsidy. As long as they're not getting government subsidy, they can keep what they have. Okay, so if they went out and got their own private plan and didn't ask the government for any assistance, then it's okay, because you're less than 50, you're not mandated. Now, the problem you're going to run into is employee participation if you got a lot of people doing that. And a lot of your employees are going to qualify for subsidy. And I'm going to show you won't believe how much subsidy they get. They're going to get insurance for like $10 a month, $30 a month. It's pretty good. Large group is required to offer that. But for this year, and this year only, they took that mandate off of the penalty. It's still mandated, but we're not going to penalize you with income. Next year, 2015, you're going to be charged $2,000 per full-time employee, excluding the first 30 employees. So if you decide that you're not going to offer insurance, or you have 60 employees, well, at the end of the year, you're going to pay the IRS $60,000. If you skip down to the bottom, it says, unlike employer contributions, that $60,000 is not going to be a write-off. It's going to be after taxes there.
Rob,
If you,
going back to the small group, I'm sorry. Going back to the small group, you're saying there's going to be some kind of tax benefit, but it's probably not going to make sense still to offer it. Is that correct?
right, so basically if you're paying 50%, 50% of the 50% of contributions, so really in essence 25% of what it costs, you're going to get a credit back. You're going to be credited, so it's like it's written off for expenses to make it affordable for the employer to contribute.
But most likely it's not going to make a whole lot of sense.
It's not going to make a whole lot of sense. I'm not supposed to say, but yeah, it's not going to make a whole lot of sense. Yes, it's not going to make a whole lot of sense. That's for year 1. Year 2, it's going to go to 35%, and then year after that, it's going to drop. So they're going to like wean you onto paying is what they're trying to do.
Yeah.
Okay? Any questions on this so far? Lots? Studying? If you do offer insurance, but the insurance does not meet minimum requirements, your annual payment is higher than the $2,000. It's $3,000 per employee. Okay, so every employee that did not get the qualified health plan through the group coverage, you're going to pay $3,000 instead of $2,000. Of course, after your first 30, all it takes is one employee to trigger their penalties. So if one employee goes and gets the government subsidy, and they're going to have your business ID number on that, they're going to trace it and see, okay, one employee went. And then once they have 30, then they're going to start applying penalties to you. Okay? W-2 employees, not 1099, not your hairdressers, bartenders. Sometimes they're not doing that, but only W-2'd.
For companies under 30, offering like voluntary insurance doesn't even make sense. Either
Well-
way, right? You're hurting your employees.
We're going to get there.
Okay.
We're going to get there. Your employees are actually going to make out very well, and so will you.
Rob, one other question then on the big group. I used to have leasing for all my employees because I have to for workers' comp because it doesn't make sense, to run it and pay for the workers' comp outright. That being said, then I'm considered in a large group with them because my employees are basically paid by the leasing company. They're not paid by me.
Staffing agency owns those.
Yeah, they're responsible for it.
So that would fall into that larger than 50 group.
Right, but they're going to be responsible, not you.
They're gonna be
They're
responsible.
going to not.
Right. You're only responsible for the payment if they choose to take the health insurance when you pay your half. Okay, on the leasing seal. Avoiding the tax. Here's how you can avoid the tax. Acquire a qualified health plan. So your health plan you're paying the nice cheap amount for, go spend about $1,000 now. Kidding. Next thing you could do is if you're uninsured for less than 3 months of the year, you can avoid the tax. So basically, let's say you had insurance 9 months out of the year. Just because you missed 3 months, they're not going to penalize you. Once you're uninsured for 4 months, then they're going to start penalizing you, but it's prorated for how many months you're uninsured for. The lowest price coverage available to you would cost more than 8% of your income. So if you go to buy health insurance and the lowest price available on the marketplace with subsidy is more than 8% of your income, you don't have to worry about being penalized for health insurance. And it will happen to some people.
How would you demonstrate that?
8% of your income?
So the prices of the policies are known, so that they're not adjustable according to?
They're not adjustable to anything except for if you're smoking or non-smoking and zip code. really where you're based on, and age. So it's zip code, age, and smoking. Those are the three things, the three bands are allowed to do. So when you come and you sit with an agent, or if you talk to a navigator, one of the criminals, kidding, on the phone, working with all the carriers like we are, they can show you all the carriers side by side. So you can kind of see which is going to be the best deal for you. You'll pretty much know, actually, if you go on to, there's two websites if you want to write them down, valuepenguin.com and kaiserfamilyfoundation.org. And you can look up the calculator, see what you qualify for subsidy. I have to say the KFF.org with the calculator, they're really, really close. I mean, they've only been off by like $5 to $7 on every person I've done. So they're really, really good. Value Penguin, their subsidy is off, but their rates are correct. So at least Value Penguin would show you side by side, your Coventry, your Florida Healthcare, your Blue Cross. Now, they don't show you everybody. And that's one of the problems you're going to see as well, as we talk about networks and what plans have PPOs. You're a member of a federally recognized tribe. So if you're an Indian or are eligible for services through an Indian health service provider, you don't have to worry about the penalty. If you're a member of a recognized health care and sharing ministry, or part of a church basically, religious objections, insurance, including Social Security, Medicare. So if you're one of those that doesn't believe in that, it's part of your religion, you are exempt as well. You're going to have to show proof though. And you do have to go online to healthcare.gov and basically ask for a pardon for it. If you're going to jail, you don't have to worry about it. So if you want to go commit a crime, that's there for you. If you're not lawfully present in the U.S., you're not going to be penalized. Boom.
Question on that, if you're 6 months there and 6 months outside of the U.S.?
But you have legal residency here?
Yeah.
Okay, then for that 6 months, you have to have your coverage. Okay? Otherwise, you're going to be prorated of 6 months. In your case, if you are 6 months here and 6 months there, you're better off getting an international plan and just probably paying the penalty, just throwing it out there. What we're trying to tell you here is to buy health insurance or else. You will not end up in jail if you do not have health insurance. I've had clients call me left and right, I need health coverage, I don't want to go to jail. You will not end up in jail if you do not have health care. You'll just make a lot of agents very unhappy. What do you do if you don't have the health care? You just pay the tax. So there's you, there's Uncle Sam. We're going to talk about your current coverage versus Obamacare. Your current health plan. Remember, you can keep your plan. Qualified health plans. We're going to do a comparison. Type of coverage and networks. This is a very, very important thing to keep in mind. And subsidy, another important thing to keep in mind, see if you qualify. Your current health care plan. Can you keep your plan? It's possible. As long as you purchased it before March 23rd of 2010. If you purchased it after March 23rd of 2010, you will lose it by January 2015, the latest. A lot of people, a lot of agents are trying to keep clients on the books, and people are calling in, hey, am I okay to keep my plan? Well, if it was after 2013, you basically bought yourself another year. Even myself and my agents, there's products out there where we're like selling a product where it guarantees 1 year of the same price and same benefits, but it's only good till 2015. Essentially, everybody's going to have essential health care benefits.
Can I ask you, what do they mean by keep your plan? Like the same coverage, the same...
Same coverage, the same coverage, but the rates are still subject to go up. And a lot of the carriers you're also going to see, I also get this. My coverage just went up. It went up to $600. I was paying $300. Why? Because they're changing a few things. They're adding a few things in there, essential health benefits, which is what we're going to go over. Now, believe it or not, these essential health benefits, a lot of them are kind of, six of one, half another. The rest of them are going to be very, very good for you, and you're going to see why.
When you define essential health benefits, are you saying those are the required benefits? that
Required-
care-
The baseline.
Required benefits that a health plan has to cover.
Okay, just wanted to clarify.
Hospitalization has to be covered on your health plan. Believe it or not, there's health plans out there that does not cover it. A lot of those limited benefit plans, that pay $100 a day for confinement, doesn't do anybody any good. Maternity and newborn care. A lot of people do not have this because it's not offered, or even if they do, they'll have a deductible, they'll have a maternity deductible, a co-insurance, and a max out of pocket, and before you know it, they paid for everything. In the maternity and newborn care, let's say you had a child and child's a month old, they're going for all those expensive shots. They're now covered first dollar. They're not going to be applied to deductible where you're hitting your $5,000. Those are covered front-end benefits. Breast pumps for breastfeeding. Females have to go to the store, pay $130. They're going to be covered now. Mental health and substance abuse, okay, will be covered. So when I say mental health, I'm not saying someone has the crazies, but if they have, let's say, anxiety, depression, one of those two things, they take alprazolam on, their drug may not be covered. And they might be paying $30 or $40 for that drug, where if it would have been covered or at least discounted, they might have got that drug for $5 or $10. So that's now going to be covered. Prescription drugs. There's plans out there without prescription drugs coverage. Those will now be covered. And to elaborate on prescription drugs, there's a lot of healthcare plans out there that only cover generic. I have generic coverage but no brand, or they'll cover brand tier level 1. What happens if you get cancer? What about tier 2, 3, 4, and 5? Not covered. Or if it is, it's covered at 50% coinsurance. And if that's the case, you might even hit your deductible, you might hit your max out of pocket, but even if you do, you're still paying copays. They've eliminated that now. Rehab services. We've had clients with, even a Blue Cross or United, any of the name brand carriers out there that may have had maybe a knee surgery, got their surgery covered. But what about rehab? Costly thing to go to. That is now covered. Laboratory services. This is really for those, not to put a company down, but hospital surgical plans. Okay, you ever had a card and it says Hospital Surgical Plus on there? Those plans are only good for hospitalization. A lot of them do not cover labs. So your simple blood work, your physical blood work is not going to be covered. Now they will. Preventative and wellness services. This is your colonoscopies, your mammograms. What else is on there? Preventatives. Colonoscopies, your mammograms, your blood work, your doctor visits, you go to one a year, your physicals, those are going to be covered 100%. So you don't have to worry about a copay. Or if you didn't have a copay, those are covered. Some of you think that you're getting your free preventative. Oh, I just paid my copay. Well, you're on an older plan. You shouldn't have paid a copay. You must have thought we were done, but we're not. We just had one come to the top there. Ambulatory patient services and emergency services. There's plans out there that do not cover that. Pediatric services. Anybody here have kids? Okay. Anybody here have an extra dental plan just for them, or ever had to get braces? Okay, well that's now covered on the plan. As long as they're under age 19, they're also going to get vision. Okay. Now those of you with pre-existing conditions, I put my hand way high. Okay, it's hard to find insurance. Pre-existing conditions are no longer an issue. So you can get a plan, and that means if you get it, it doesn't mean, hey, I have health insurance, it's not an issue. It means, no, you have health coverage and you can use it. Big difference. So more on qualified health plans. What are they? They've all been labeled with metallic values. You have bronze, silver, gold, and platinum. Now bronze should cover 60% of medical expenses in a year. The silver's at 70, the gold is at 80, and the platinum is at 90. That's not coinsurance. So that doesn't mean if you have a bronze, it's a 60-40 plan. There's 80-20s, there's 50-50s, every carrier is different. Those are actuarial values. That's basically the government got together and said, hey, if they have this plan, we believe that in any given year, it should cover 60% of their bills. Silver plan, 70%, gold, 80, platinum, 90.
Rob, quick question. I hear this through the grapevine because I'm not involved in all this and checking up on all this as much as you do. But that being said, I hear that they're trying to make delays and everything because they've had problems with the website and all this stuff going on. Is all that stuff true, or is it still going to go into effect, the plan for January 1st, 2014?
If your friend is giving you information on health insurance, trip them. Okay? Do not listen to anybody telling you about what's going on with the websites, this not working, that not working. It's not true. The website, okay, is up and down. Well, I have successfully completed, I want to say, about 8 people in the past 3 days for Obamacare Subsidy. It's working, and in the moment we hit submit, 45 seconds later, they're approved. So, I mean, all those things that hearsay, it's a lot of people that are upset with it, disgruntled about the law. They don't understand the law. It's their own ignorance to really find out what's going on, how it can benefit them. Just don't listen to them. Listen to this presentation.
And those plans won't go into effect until January 1st?
January 1st. Every plan that's going to be with a metallic value is going to be January 1st effective dates. You can purchase them now to get into effect by January. There's been some misconception that, oh, we had to buy by October for January 1st, February for February 1st, so on and so forth. You have all the way up till, I want to say, December, 15th to get a January 1st effective date. So you have till December to get that. Then you have January for February 1st. It's going to be the first of every month. There's no more of this, start on any day deal. It's going to be the first of every month.
Quick question. Is there a breakdown of metallic bonds and gold coverage?
Break it down.
You said something about 50% paid. What's that mean?
No, I'm just giving you actuarial value. Actuarial value is basically what the government says, if you have this plan, that it should cover 60% of your medical bills in a given year for the average person. Silver plan should be 70, gold is 80, platinum's 90.
30% out of your pocket?
No. See, you're thinking co-insurance. I'm going to skip to the next one. I'll show you. Qualified metallic plan examples. Okay, this is a carrier. This is one of. There's only 2 PPOs, true PPOs in Flagler County, by the way, for carriers. This is one of them. First plan there says bronze. Your deductible is a $6,000 deductible, which means that you're going to pay the first $6,000 of medical expenses, and everything's covered at 100%. Now that's 100% coinsurance. So you notice that's a bronze. That's not a 60/40, right? So that's just actuarial values. They're very confusing, and a lot of people don't like discussing them, but coinsurance, if you're looking for coinsurance, it's right there. They're going to look just like this. Now, every bronze plan is not necessarily the same. Their actuarial value is the same. It's what they felt was going to cover 60% or 70, 80, or 90, but every company is going to be different. This company here has 5 series of the bronze plans. This is one of them. This bronze plan has no copays. Well, bronze level 2 has a copay for $35. So there's different variations of bronze, but how much do you want to pay? It might be $5 more for those copays. Might be worth it to you. So there's a whole lot of things you're going to take in consideration when choosing a plan. Silver plan, as this example, is a $2,000 deductible. You pay 50% of the benefit till $6,350. Now, something I'm going to point out to you. Notice that when I said on a bronze, $6,000 deductible, it is your max out of pocket. Whereas your older plans, prior to 2013 or 2010, a lot of them is, hey, you have a $6,000 deductible, you have 80/20, let's say, 20% coinsurance, a max of another $5,000. You add those together to get your total max. These are inclusive. That's a big deal. Silver plan, $2,000 deductible, 50% coinsurance till a max of $6,350. So what that means is you pay the first $2,000, then you're going to have another 50% coverage till $4,350. See how we did the math there? It's combined. Gold plan, $2,000 deductible, 100% coinsurance, $2,000 max out of pocket. Everything's applied to deductible and coinsurance. I actually took a platinum plan. That's platinum 2. I took a platinum 1 personally. It's a $950 deductible. They're like $1 off of each double for a specialist on average. Prescriptions, 10, 30, 50. Okay? These plans here cover all those type of prescriptions, tiers 1, 2, 3, 4, and 5 that we were discussing before. Any questions on metallic examples? If you're confused, you might have a question. That's fine.
My question was just, obviously, the cost of those goes up if you get that.
Right. I'll give you an example. I'm 23 years of age. The platinum plan, the platinum level 1, was $310 a month for me. I do not qualify for subsidy, though. If I qualify for subsidy, I might pay maybe $50 a month. Okay? Qualified health plan, dental services. So we're talking about dental. Now, it would have been sad if we said, hey, it covers dental, but you got to pay that $5,000 deductible first. If you read here, not subject to plan deductible. Look at the top left there. So that means your child goes in for a cleaning or preventative benefit, you're going to pay nothing. Basic services, that's like your fillings, your anesthesia, 20% coinsurance. So a filling is usually about $100 for tier 1, so you're going to pay $20 for a filling for your child. That's awesome. Major dental services. This is going to be your root canals, your caps, your crowns, 50% coinsurance. No waiting period. Okay, I don't know how many kids need crowns, but a lot of times you get a dental plan, you got a year wait, 2-year wait, 3 years, it all depends on what you have. Insurance companies making money and you're giving it to them. Orthodontic dental services. A lot of dental plans do not cover orthodontics. And orthodontics, just for a rule of thumb, if you're getting charged about $3,500, that's a good deal. If you're getting charged around $5,000 to $6,000 for orthodontics, find a new dentist. So just telling you what's out there. But they're going to cover 50%. So if your orthodontics was $3,000, you're only having to pay $1,500 now. That's a good deal. So these are all the good benefits that they don't tell you about from your friends, your news, etc. These are things on there. We're not done. Children also get vision. They also get vision benefits, subject to plan deductible and coinsurance though. Okay? They do get choice of 1 pair of glasses or annual supply of contact lenses for eyewear in the pediatric eyewear collection per calendar year. So they will get one or the other. Personally, I would take the contacts. They cost more than the glasses. Get $30 cheaters. But the children can get this as long as they're under the age of 19. Any questions on pediatric care? All right. More on qualified health plans. This is actually a real comparison. This is one of my clients, actually in South Daytona. Not going to give names, of course, but he was 35, his wife was 35. He has an 8-year-old son and a 5-year-old little girl. His plan there, he had the before 2010 coverage. His wife is currently pregnant. His plan does not cover pregnancy. He also has a bum shoulder. It's not covered. It's excluded from his plan. A lot of those plans out there where they covered you, but they excluded what you needed help with. Does not have wellness and preventative coverage, nor pediatric care. Children are healthy, but they still have to pay all the doctor visits out of pocket because they do not have co-pays. Where on pediatric care, they get their wellness visits. Never hits his deductible. On the left, he had a $5,000 deductible. 80/20, he's doing pretty good. $15,000 max out of pocket. So catastrophically, $20,000 if something were to happen. That's just to one family member. Okay, these are the type of plans we have, and agents, are trying to make their sale and don't show you max out of pocket and total max. They're saying, hey, it's $15,000. No, it's $20,000. Is what it looks like. He was paying $768.19. He had a PPO. The new plan that we showed him was a $6,000 deductible, covered at 100% after. Of the two so far, I haven't even went on further, which one would you choose? One on the right. $6,000 max out of pocket. Plan is $120 less a month. He did not choose this plan. He chose the bronze plan for him and his sons, but since his wife was pregnant, put her on a platinum plan because you can separate plans with that $950 deductible like I got. He paid $790. Okay, so he paid $30 more a month for a $1,000 deductible for what he needs for his wife to be able to have that baby come January. So these plans are actually do very well for you. Next thing.
May I ask a question?
Sure.
Does that make a difference on his income?
That was no subsidy. So he doesn't qualify for subsidy, but if he qualified for subsidy, that's let's go back. Boom. All right. So that's 641 there, that was a bronze plan. Let's say he qualified for subsidy. Let's say he made $40,000 a year and maybe they paid $3,000 of it per year. He might have to pay $350 a year or a month for that. So I'm going to show you how subsidy works here in the next couple slides. But you'll
Max out on your income?
It does. I think a family of 4 is around $92,000. And they'll say, they entice you by saying, you qualify for subsidy. And you're thinking, hey, I make less than $92,000. You go to apply, but it might be $3 a month. So it depends on where you're at, how many kids you have. The younger you are, the less subsidy you get. Okay, so great example. If I have a $30,000 a year making female who's 63 and the 23-year-old making $30,000 a year, this 63-year-old is going to get like $500 a month of subsidy, whereas a 23-year-old is going to get maybe $100. So they're really trying to get the younger people to participate with high costs like that. I don't see it possible, but we'll see. Time will tell. Type of coverage and networks. PPO. That is a preferred provider organization. This is the plan that everybody calls, I want a PPO, I want an 80/20, they come calling. PPO means you can go basically wherever you like. Now, of course, you want to use traditional PPOs are kind of obsolete where you could go wherever you wanted and it didn't matter about being a network. But of course, with PPOs, you have networks and you get better discounted rates by using one. That's preferred provider. The next one is a POS. Most of us have a different idea of what that means, but it stands for point of service. Okay, it is basically that. A point of service plan is kind of like a hybrid of an HMO and a PPO. It's an HMO plan, don't let them confuse you, but you have point of service. So you can choose a couple different PPO doctors in the area. So that's where they have, oh, it's a PPO. It's not, it's an HMO. Here's our HMO, the one we were just talking down about, but still not bad for affordable coverage. HMO is a health maintenance organization. This is for you, those of you that like referrals and asking permission from your healthcare provider of what you can get done. This is an HMO. Next one is an EPO. This is going to be very popular. It's going to be very popular with the blues, cough, cough. EPO is exclusive provider organization. An exclusive provider organization basically is a PPO. Okay, in a way, it's how do you want to say this? You have a very strict network of doctors, okay, but you really can't go out of network. You have a PPO plan, but only the PPO of the doctors they say are in it. Are we following that? Smaller network? Okay.
What's the difference between that and an HMO?
What's the difference? Is you don't have to ask permission to go see your doctor. That's basically about it. The PPO is going to have the large network of doctors. Typically a PPO plan, the doctors make more money, so more of them want it, off the plan, off the fee schedules. Here's ACO. You're going to see this is very, very popular. ACO is Accountable Care Organization. This is one that is affordable. Usually it's probably going to be the cheapest one out of all the ones you look at. But your doctors will actually get bonuses for denying you coverages, like saying that you're healthy, you don't need this thing done. It's going to be an HMO, but even smaller. You have a smaller network of doctors. ACOs are typically what Medicare uses. Okay, they are a smaller network of doctors. You're going to see your ACOs on your United Healthcares now, your Aetnas, I believe Coventry, and because Aetna owns Coventry. Those three are going to be primarily your ACOs. Any question? They're kind of like in order of what's the best to have for you, in my opinion. I'm stating an opinion, not a fact. So I'll make that clear. Anybody want to keep writing them down, or good? Here's an example of a bronze plan. Okay, we're talking about rates and subsidy. These are two more of my clients. Client on the left, Port Orange, Florida. She makes $30,000 a year and she's a non-smoker. Yearly, her cost of insurance for a bronze plan, that's that $6,000 deductible, costs $6,203 per year. They're going to give subsidy of $5,452 a year. She's stuck with $751 a year for health plan. Divide that by 12, it's about $65 a month. That's not bad for a catastrophic health plan. So she has the same choice. She can buy a higher cost plan and still use that subsidy, but I want to give you a most affordable scenario. Okay? Some people are going to say, hey, you know what? I will take that low cost and that $5,000, I'll supplement it with like those AFLACs out there, or Assurance, or supplemental Section 125 plans. On the right, 46-year-old female. This one's actually in Bunnell. $17,000 per year. Works at a little restaurant out there. $3,152 a year is the cost of her plan. For the same plan that the 63-year-old, she's getting $3,143. She's paying $9 a year if she takes the bronze plan. Some people are going to make out like bandits. If you want to get quotes like this and actually see if you qualify for subsidy, there's our website, and we made a quick link for it. If you go to myfloridainsuranceteam.com/myfit, or just go to myfloridainsuranceteam.com, center of the page it's going to say Healthcare Reform Tools. Click it, then click on Calculator, and you can actually plug in your info on the Kaiser Family Foundation calculator and see what you qualify for.
Got a question. How do you determine your income?
It's going to be your modified adjusted gross income, okay?
Well, because when I moved here a couple months ago, I quit a full-time job, and now my business is my sole income,
Okay.
which is much lower than what I was making in my full-time job. So am I putting in what I've made?
You're putting what you're going to make for 2014. Does that answer you?
Yes, thank
Okay.
you. That's the right answer.
You're projected. Now here's the downside. If you make more than what you you anticipated, you have to pay back the subsidy, plus interest, plus a penalty.
All of it.
All of it. Not all of it, sorry, the difference of what it is.
I see.
The difference, okay? But plus interest, plus penalty. So, kind of offset you there.
In these examples, is it a combination of age and income?
Yeah, this is age and income. That's 63 at 30,000, 46 and 17.
Not solely income, it's age and income. There's
Yeah.
an algorithm there.
Age and income is going to differentiate. When we're done, I'll actually show you on the website. We'll put in a couple ages and some guesstimate incomes and show you how that works. So these are bronze plans. But even for $9 a year, she's happy. She's going to go get her mammogram yearly for free, preventative care, you know. Prescriptions are now going to be generic, $4.
And that includes hospitalization?
That includes hospitalization, okay? But you have that $5,000 or $6,000 deductible on that. All right, how do you qualify for subsidy? You have to make more than the 133% poverty level. Now, I can't give you the exact amount because it's going to go off of how many people in the family, how much do you make. So everybody's going to be different. So there's a scale. You can actually go on the healthcare.gov website and find that, or I can show you after hours. You must earn less than 400%. So for a family of 4, it's less than $92,000 a year. Okay? You must be a U.S. citizen or have a green card. No employer coverage offered to either spouse. So those of you that have you heard about the UPS laying off spouses coverage? No? Anybody? No? There's a lot of carriers out there or companies that are going to say, you know, we're only going to offer coverage to our employee. Well, the employee's family cannot get subsidy. If the employee is offered any type of coverage, you cannot go get subsidy. The high schools, the schools here. I have a bunch of clients that I've been picking off left and right there because they'll pay on their plan. They have their cheapest plan is a Florida Healthcare HMO, $7,000 deductible. And for one of my teachers to add themselves and 2 kids, it's like $1,200 a month. I gave them a plan with a $2,000 deductible there. So, but if you do have employer coverage or it's too expensive to add yourself to add the spouse, you're not going to get subsidized coverage. I will show you alternatives though.
A question on that, Rob. If you're already retired in that company?
Well, that's a case-by-case basis. A lot of times if you're retired, it's already part of your package, so you shouldn't have to worry about it, but it's a case-by-case thing. Some of them have it in their writing that they can change it. So,
Can I ask one question at this point? So what you're saying is that if a spouse has group coverage, but it's expensive for you to be on it, I have a friend in this situation. You have to get your own insurance if she chooses not to be on that, and she's not entitled to a subsidy?
if she's choosing not to take the government or the employer coverage that's offered,
Is it more expensive than getting an Obamacare?
right. And that's why a lot of small business owners are starting to see that they're better off, they're disabling their employees in a way by offering. A lot of them are going to do much better, because what does an employer usually do? Pay half of the employee. That whole expensive amount is because it's the family. You know, there's no, and even if it's just a wife and no kids, it's
Wait,
family.
wait. So what I'm saying is she chooses not to be on this policy because it's expensive.
She cannot get subsidy.
She has a Blue Cross policy, which was dropped. So she cannot qualify for a subsidy?
If her husband is offered coverage at work and she's the spouse, she cannot get subsidy.
Even though they refuse to offer it to the spouse.
Even if they refuse to offer to the spouse. And also, take it a step further, your McDonald's, your Lowe's, your Home Depots, Hooligans, there's a bunch of places, of restaurants, or, not Hooligans, the heck is it? I forget the name of it. Any of those big, large corporations, it's a large company, so definitely not Hooligans, is going to be offering like Aetna plans, or those like mini meds, okay, where they look like major medical. There'll be a $2,000 deductible, it'll be 80/20, but they don't cover more than $10,000 in a year or $20,000 in a year. That's not a lot of coverage. You have a heart attack, you got a big bill in your hands. There's companies that were allowed to offer that, and if they offer that coverage, you still do not qualify for subsidy. So that's all the big money at work. You know, they want to be able to have, because those mini med plans don't cost them any money. They're kind of like those cafeteria, Aflacs, you know, where it's all voluntary benefits. So if they're offering those type of mini meds, you don't qualify for subsidy.
So if you're a small group, under 50, and you offer a group plan, you still have to pay 50% like we've always had.
At least.
Okay.
Yep.
I would offer a group plan, I would offer an individual plan.
You're doing individual plans.
Yes, sir.
Are you doing it on a legal defined contribution? There's only one carrier that's allowed to do it right now. There's only 25 agencies in the U.S. that can do it. So you just want to make sure it's with the right carrier. We'll touch base on that one later. That's called individual plans at work, and that's where we're headed with this. Healthcare options. Individual and self-employed, small and large group. Here are your options. Major medical qualified health plan. There's two other type of health plans that are circulating the market, becoming more and more popular. Actually, fixed benefit plans are becoming very popular. They are non-qualified health plans. Okay, they cost a lot less than a qualified health plan. Actually, some of your rates are on, if you grabbed a flyer, you can actually look at a rate with health and dental. Those are fixed benefit plans. A lot of people are going to say, hey, you know what, I'll take a non-qualified health plan and pay the penalty. It's still cheaper than having the Obamacare. Those plans have no deductible. So there is a catch. You have to qualify. My wife and daughter have it. Type 2 diabetes does not. So there is some medical questions you do have to answer to. Short-term medical is out there, and I usually don't try to talk down products, but if you have pre-existings, stay away from it, okay? Because they're going to say, oh, we can cover you, Mr. Type 2 diabetes, but we're covering everything but type 2 diabetes. So you had a heart attack, we're going to link that to diabetes. You have high cholesterol, diabetes, everything's not covered. And another downside to that is they're good for 3, 6, 9, or 12 months. Well, great, in 12 months you can use it, but you got to renew. So now it starts over again. So you're in this big wheel of no coverage, you're just spending money. So I'd stay away, you're better off going with a qualified health plan. I'm always going to recommend the qualified health plan over everything, but if it comes down to affordability, there are other options. So self-employed, major medical. Here's another example, of course. We're bringing it back up. Bronze, silver, gold, and platinum. So you can look at the styles of coverage you have there for you. This is an option. You can go with a major medical qualified health plan. They're available to you. Short-term medical plans look exactly similar, but if you look all the way to the left, they have something called a lifetime max. Cannot be a major medical with a lifetime max. They also do not cover qualified or essential health benefits. Okay, so they're not going to cover those mammograms at 100%. They're not going to cover a colonoscopy. They're really, what they were meant for is that transition between jobs where you're waiting on your 90 days or 60 days or 6 months to get coverage. Yeah, your COBRA. Cheaper than COBRA by far. Okay, if you qualify. And there's a carrier that takes on different risks with short-term medical, so there's no one carrier fits all. If you get denied from Blue Cross, it's not the end of the world. You can go look at Assurant, Multiplan, IHC. There's so many carriers out there that do it. And they have copays, and they look pretty appealing. But like I said, the downside is if you have any type of pre-existing or anything in your past that you may have forgotten about, it could be brought up, and that skeleton's there to haunt you. If you're 100% healthy, this is going to be great. It's going to be great every year. It's going to be a lot cheaper if you don't qualify for subsidy, that is, and you can get away with one of these short-term medical plans. This very next, any questions on these? This next one's going to confuse you all. So, are we already confused? Do I need to go back?
Start from the beginning.
Okay. All right, this is Healthcare 101. Any questions on what you can get, what your options are as far as major medical and short-term medical? Better of the two? You want a recommendation? Major medical, go for the Obamacare. The next one I'm going to show you is a very popular plan for us. It's called a fixed benefit plan. This is a non-qualified health plan. You are going to get the penalty if you take this, but no deductible, first dollar coverage. Think of your employees. Even if your employee got that $9 a year plan with a $5,000 deductible, divide that by 12, can they afford that monthly for medical? Probably not. They cry about copays being too high. A fixed benefit plan, I'm going to read it off. I'm going to start with the top left. They are a limited plan, okay? They are not illegal. Only limited major medical plans are. These are not illegal. $75 per doctor visit. Doesn't sound like a whole lot. Do you remember the old style indemnity plans where if you didn't qualify for nothing, we have something for you, but it didn't cover anything? Well, these have a network. So I'm going to show you examples of doctor visits. These are real bills from clients. Actually, some of them are mine. Here. Boom. Doctor visit. This is a regular doctor visit. Your most common doctor visit is a billing code 99213. It's a 15-minute exam. Pays fixed benefits. The first one I'm going to show you was a $135 doctor visit. Just for having insurance, they only had to pay $48.20. But because this is a fixed benefit plan, your employee did not pay. The benefit pays $75. So the bill was $48.20. They paid the provider, and your employee got a check back for the difference. This next one was a specialist visit. Was originally, where is it? $195. They took it down to $78.28. We pay $75. They paid $328. How is that for a copay? These aren't copays. These bills, they do not pay up front. They will actually get a bill for that $3, or you'll see one for 57 cents on there as well. Here you go. Here's the 57 cents one. So you just pass them along. The bill, this is a value plan now. This one only pays $50 per doctor visit. Bill was $50.57. They paid $50. Client paid 57 cents. Now these are a new style of coverage. You're going to see these.
Rob, you're saying if you for one reason or another choose to pay the penalty,
If you, for one reason or another,
go for something like that.
go for something like this. Because some of you are going to see the rates, and if you don't qualify for the subsidy, they might be scary. You know, I'm going to recommend Obamacare first. It's full coverage. Okay, it's the best thing to have for you, a major medical. But if you do not qualify for subsidy and you can't afford the premiums that they're offering for you, take a look at these. This is blood work. This is at Quest Diagnostics with $700 of blood work. My client can quit their job and go to the doctor every day to make money. They will limit them to 4 doctor visits a year, 1 urgent care per year, etc. But it's a new alternative.
But these plans aren't going to cover the pre-existing.
To be determined, they are going to put a 12-month wait on pre-existing conditions. Okay. After 12 months, they'll start covering them.
But with these, you would have to pay the penalty.
Pay the penalty. So if you are a 40-year-old fella and you want an Obamacare plan, I'll give you an example, they're about $400 a month for a bronze. Oh, no, I'm sorry, silver, about $400 a month. You can either pay $400 a month, or you can get one of these, health and dental, for $193 and pay $600 out of your tax return. You're saving about $2,000 a year by taking the penalty in that
For the
case.
first year, but then the second year is going to go to 2%.
Right.
Third year is going to go to 2.5%.
Right, 2.5. They're going to cap out at 2.5%. Yep. So that's where you're going to come out there and outweigh. But now the next thing to look at is, hey, I'm paying this much money. What about my deductible? Now you got to worry about paying for coverage on top of your plan. So.
Who gets a tax return? I don't pay.
Yeah, me too. Quarterly.
So you'll pay more.
Yep. So healthcare options. Small and large group, fully insured, self-funded, individual plans at work, and uninsured. Those are your options as a business owner, what you can do. If you're a small group, Fully insured, that's your traditional healthcare. Okay, traditional group plan where you pay 50% of a plan, the employee pays 50%. Many small group employees are dropping this style of coverage because the cost is going up, the cost is expensive to begin with, participation is a big deal. Many of your large group will still offer this type of product. So your huge corporations are more than likely still going to offer this. The next one is a self-funded. That's